गुलाब खिल रहे हैं, आंधियों में चिराग जल रहे हैं. Ladies and guests, distinguished guests, esteemed participants, a warm morning to all of you. It is with a great pleasure and honor that I extend a warm welcome to each one of you to Board of Research in Nuclear Science sponsored National Symposium on AI RadPharma, the future of medicine through artificial intelligence in Radiopharmaceuticals by Chameli Devi Institute of Pharmacy, Indore. Once again, we are proud to announce the BRN-sponsored National Symposium on AI RadPharma, the future of medicine through artificial intelligence in Radiopharmaceuticals, which has been organized at CDIP. This symposium is organized to provide a platform to faculties, students, researchers, and corporate experts to express their knowledge in the field in which they are working. CDIP is deeply involved in research, innovation, and bringing the innovation culture into the organization. Emphasis is given to encourage students to think innovatively and supporting their innovative ideas and transforming them into reality. Students and researchers get the opportunity to present and publish research papers in the souvenir. A separate series of talk on various areas of artificial intelligence and radiopharmaceuticals will be organized in this two-day event to promote the research culture in the institute. So, with these words, we are delighted to greet all the esteemed dignitaries to the inaugural ceremony of this wonderful National Symposium. With the blessings of our Honorable Chairman Shri Vinod Agrawal ji, Vice Chairman Shri Sanjay Agrawal ji, Chameli Devi Group of Institutions, with the blessings of Anusha ji Agrawal, Executive CDGI, with the blessings of Founder Professor Dr. Arun Kumar Gupta ji, Chameli Devi Institute of Pharmacy, Indore, we embark on this journey of knowledge and innovation. We are deeply honored to extend a warm welcome to our distinguished guests, including Professor Dr. Dipendra Singh ji, Chairman, Education Regulations Committee, PCI, today's chief guest. We are also honored to have with us Anusha Agrawal ma'am, Executive CDGI, and above all, in addition to our esteemed guest, we and revered faculty members, it is a privilege to extend a warm welcome to the principals from various colleges across the city. Your presence here adds immense significance to a gathering, symbolizing the spirit of collaboration and shared dedication to advancing education in research. We have a convener with us, Professor Saurabh D. Jain sir. He is the conference convener and associate professor at CDIP. We deeply appreciate the enriching exchanges and insights that will transpire throughout this conference. Today, we extend or stand at the intersection of two revolutionary fields, artificial intelligence and radiopharmaceuticals, that we are shaping a new era of healthcare. Together, they comprise innovation that go beyond conventional medicines, enabling more precise diagnosis, personalized treatments, and predictive insights that once seemed like science fiction. We have delved into this symposium. We invite you all to explore how AI can define every aspect of radiopharmaceuticals, from drug discovery and development to imaging and therapeutic applications. Today's discussions and presentations represent not only advancement but a remembering of the possibilities for patient care, safety, and outcome. Now, ladies and gentlemen, before we commence our program, let us participate in the World Peace Prayer. May I request everyone to please raise on their seats, join their hands, and participate in this World Peace Prayer for humanity, for mankind. I request the technical team to please play the World Peace Prayer. I request everyone to please raise on their seats, join their hands and participate in this World Peace Prayer.
जय जय स्वसंवेद्या आत्मरूपा देवातुति गणेषु सकलार्थमपि प्रकाशु गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरः गुरुसाक्षात् परब्रह्मा तस्मै श्री गुरवे नमः। पूर्णमदः पूर्णमिदं पूर्णात् पूर्णमुदच्यते पूर्णस्य पूर्णमादाय पूर्णमेवावशिष्यते। ॐ शान्ति शान्ति शान्तिः।
Thank you everyone. Please do take your seats. Moving forward, we are going to have a traditional auspicious lamp lighting ceremony. Light expels darkness and is a symbol of wisdom, knowledge and purity. To grace this occasion, I now invite esteemed chief guest, Principal Pharmacy and Anusha ma'am to please light this ceremonial lamp. This lamp is a tribute to Saraswati, the goddess of wisdom as knowledge, whose blessings guide our path. Accompanying the lamp lightning, we have a soulful rendition of Saraswati Vandana by Harish Prajapati and music by Piyush Gaur, B Farm second year students.
तुषारहार धवला या शुभ्रवस्त्रारिता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्करप्रभृतिः देवैः सदा पूजिता सा मां पातु सरस्वती भगवती निःशेषजाडापहा शुक्लां ब्रह्मविचारसार परमा आद्यां जगद्व्यापिनीं पुस्तकधारिणीम् अभयदाम् जाड्यान्धकारापः हस्ते स्फटिकामालिकां विदधतीं पद्मासने संस्थिता वन्दे तां परमेश्वरीं भगवतीं शारदा बुद्धिप्रदां शारदा बुद्धिप्रदां शारदा
Shivaya. As we gather here today, let us invoke the mighty presence of Lord Shiva, the dominant of strength, wisdom, and cosmic energy. Shiv Shiv Shankar, Har Har Shankar, the every utterance of these names fills the air with devotion and reverence. He is the Mahadev, the Lord of Lords, whose divine dance of Tandav symbolizes creation, preservation, and destruction. Through this performance, let us lose ourselves in the rhythmic beats that celebrate Shiv Tandav Stotra, a rhyme eking Shiva's grandeur and boundless power. Just as this Tandav brings forth the external this dance, inspire us to enhance and encourage change, resilience of growth. Jai Shiv Shankar, Har Har Mahadev. Let us embark on this spiritual journey honoring the Lord who remains in every heartbeat and is every breath. Now I invite Palak Singh, B Farm student, for this Shiv Tandav Stotra.
Jai
Spellbound. You brought the fire, divine power and the movements, feelings the stage with the spirit of power and the movements, feelings the stage with the spirit of creation, preservation and transformation. Palak Saint's performance wasn't just a dance, it was a journey into the cosmic rhythm, echoing the grandeur and majesty of the Lord of Dance. Thank you for divining and for leaving us inspired in this awe. A quick story that remotes we are going to have until stage sets. In the early 2000s, doctors and scientists face a huge challenge how to diagnose diseases like cancer in their earliest stages when symptoms aren't just visible. This is where the concept of targeted radiopharmaceuticals emerged, using radioactive substances to highlight specific cells or abnormalities in the body, making early diagnosis and possible and giving patients a fighting chance. Now the stage is set. I would request Dr. Arun Kumar Gupta sir to please escort today's chief guest on stage. I request Anusha ma'am to please come on the stage. I request Principal CDIPS Dr. Suhas Dhande sir to please take the seat on the dais. फूल है गुलाल है और केसर चंदन है आप सभी का इस मंच पे हार्दिक 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 अभिनंदन है. Yes, following Indian culture of Atithi Devo Bhava, I invite you all to join me in expressing a heartfelt gratitude and respect to a distinguished guest through the presentation of floral bouquets. These bouquets symbolize appreciation for their presence and the value they bring to a gathering. For the same, I would request Anusha Agrawal ma'am to please present a token of bouquet to a chief guest, Professor Dr. Dupendra Singh ji. Dr. Arun Kumar Gupta sir to please present a token of bouquet to Miss Anusha Agrawal ma'am. I would request Dr. Saurabh Gupta sir to please present a bouquet to Dhane sir. Principal, Chameli Devi, Group of Professional Studies. Now, as I call upon the names, it's my humble request from all the principals to please take the front location so that we can take the pictures of yours in the best possible way. First, I would request Dr. Gaurav Jain sir to please present a token of bouquet to Dr. GPC Chaudhary sir, Head SOP. Now I will request Dr. Krupa Patel Madam to please welcome Dr. Nimita Manocha, Principal IIP. Now I will request Dr. Pankaj Kushwaha sir to please present a bouquet to Dr. Raghvendra Dubey sir, Principal, Sage University. Now I would request Dr. Gaurav Jain sir to please welcome Dr. Muhammad Rizwan Khan sir, Principal, SKIPR College. Next, I would request Dr. Prerna Chaturvedi ma'am to please welcome Dr. Shelji Chaudhary ma'am, Principal, AISC, CT College. Next, I would request Jackie sir to please welcome Dr. Nimish Malviya sir, Principal, Smriti College. Next, I would request Dr. Ankit Agrawal sir to please welcome Dr. Nirmal Dangre sir, Principal, Sage University. Next, I would request Priyanka Soni ma'am to please welcome Dr. Revati Gupta ma'am. Next, I would request Shilpa Khambate madam to please welcome Dr. Karunakar Shukla sir. So here we complete a welcome ceremony. Moving forward, today we are honored to have amongst us Okay, we have Dr. Rakesh Patel sir amongst us. I would request Dheeraj Gaur sir to please welcome him. Moving forward, we have Pritesh Paliwal sir. For this, I would like to request Mr. Pradeep Singh Tomar sir to welcome him. Please do accept the apologies if we have missed someone. We heartily welcome everyone with the bottom of our heart. Once again, I welcome each and everyone present in this jury for this National Symposium 2K24. We are moving forward. Today, we are honored to have amongst us Dr. Arun Kumar Gupta ji, an extremely leader in the field of pharmacy education and research. As the founding principal of Chameli Devi Institute of Pharmacy, Dr. Gupta brings over 30 years of extensive experience in academic research and industrial collaboration. His scholarly pursuits, including a prestigious postdoctoral fellowship in computational chemistry with the University of Leeds and AstraZeneca, have led to numerous innovations in drug design, synthesis, and molecular modeling. Dr. Gupta's research spans computational chemistry, nanotechnology, and analytical method development with over 100 research articles, multiple patents, and several educational books and applications in his credit. His commitment to advancing pharmaceutical sciences and his passion for nurturing young minds make him a guiding light in the academic and scientific community. We are privileged to have him here today to lead his conference towards a new horizon in pharmaceutical education and innovations. सर के लिए कुछ लाइन कहना चाहूंगी. हजारों फूल चाहिए एक माला बनाने के लिए, हजारों फूल चाहिए एक माला बनाने के लिए, हजारों दीपक चाहिए एक थाली सजाने के लिए, हजारों रंग चाहिए एक रंगोली बनाने के लिए, पर एक डॉक्टर अरुण कुमार गुप्ता जी अकेले ही काफी है CDIP को संवारने के लिए. With these lines, I would like to invite sir for his words of wisdom.
Good morning, one and all present here. Today is one of the great day for Chameli Devi Institute of Pharmacy, because we are going to organize, or say already inauguration session is started for the National Symposium, which is sponsored by BRNS, and definitely we thought that the National Symposium, workshops, seminars is always helpful for the budding pharmacist as well as the pharmacy researcher, academicians. So in continuation of that, we are always plan to go for organizing 2 to 3 national seminar symposium workshops each year from the day of foundation of CDIP. And by the grace of God, definitely each year we also get the grants from different government agencies. So definitely the team of CDIP is quite strong and they are always engaged in such type of activity. So this is the starting time. But the most important thing is that today with us we have the ERC chairperson, Dr. Dipendra Singh, with us, they belong to the Pharmacy Council of India. So, Dipendra, I welcome you, and it is great honor for me because he is my student in the VRNS. And definitely, once one student will reach the highest position, that is the great thing for his or her teacher. So definitely, this is the great thing for us. One of the student just occupied the prestigious position in the Pharmacy Council of India, and ERC is that the Education Regulation Committee, and this Education Regulation Committee play crucial role for developing the new curriculum for the pharmacy student. What type of changes is take place day to day in the field, and according to that, we are trying to incorporate the new books, new chapters, new curriculum in the pharmacy field, so that our students always get aligned themselves with the present scenario as well as the future ready. So again, I welcome Dipendra Singh on the occasion of this national symposium. Today with us, our executive management persons is there. So I welcome Mrs. Anusha Agarwal Madam on the occasion of this national symposium. Apart from that, in this symposium, the various pharmacy institute principals are present. So I am also welcoming all of them on the request of my team. They are come here from their precious time. So welcome all of you on the occasion of this national symposium. Apart from that, the student, the participant, the delegates which come from the different part of Indore, as well as many participants are connected through online from the all part of the India. So again, I welcome all the delegates in this national symposium. Actually, for organizing this national symposium, we have some thought because there is continuously changes take place in the current scenario, and nowadays artificial intelligence come in the picture. So definitely it seems that artificial intelligence is a part of computer science, it is a part of engineering, but no, it is not the part of computer science or it is not the part of engineering, but it is a part of each and every discipline which may belong to the pharmacy, which may belong to the computer science, which may belong to the biology, which may belong to the commerce, which may belong to the history, or which may belong to the Bhugol. So definitely artificial intelligence play a very crucial role in each and every aspect. So on that basis, we just thought that why we are not going for organizing the symposium on artificial intelligence in the pharmacy field. And here we are just requested that thing to the BR that is related with the radioactive substances. So just we plan for the radiopharmaceutical, and definitely this is one of the key aspect in the pharmacy field as well as the medical field, where the imaging techniques is essential for just getting the diagnosis of the disease. Apart from that, the many deaths is take place due to cancer, and if we are looking for this radiopharmaceutical is giving the option for the treatment of cancer. So if we combine this radiopharmaceutical with artificial intelligence, then definitely it will help in early diagnosis of cancer as well as the fast calculations, and also able to give the overview of the disease in a very few seconds. Here I just give the one best example. Actually, it is related with the European country where the one kid is having a certain type of disease, and their parents is visited so many hospitals, so many physicians, so many medicians, but no one is able to diagnose what type of disease he suffer. And ultimately, ChatGPT, you are quite aware about that. So his mother is having certain academic experience. So on that basis, he is giving the symptoms as well as the diagnosis report to the ChatGPT. Means they just enter the data of the symptoms of the disease as well as the diagnosis report to the ChatGPT. And ChatGPT is just giving the proper diagnosis of that disease. Means that person is suffer from the rarest disease, and that cannot be diagnosed by the simple medicine persons or simple physicians. But that data is entered to the ChatGPT, and they immediately diagnose and just they give the type of that rarest disease. So that lady is go to this report with the doctor, and now doctor recognize, this is also possible. And after that, the treatment is start. So if we take the help of AI, then definitely we are able to recognize the severe disease also as well as the rarest disease also. So ultimately, on the basis of that only experience, I plan for this symposium, and definitely my team is writing for this, and they do many work. So again, I congratulate to all of them for just conducting this symposium, and hope this symposium will help to all the budding pharmacists, all the academicians, all the researchers to get something from this platform, and that may be helpful for their future. So again, I welcoming chief guest Dr. Dipen Singh, Madam, as well as all the principals which come from the different institute of the pharmacy colleges from the Indore. Thanks.
Thank you, sir. Thanks a lot for your kind words. Amongst us, we have the gracious presence of Dr. Love Kumar Soni sir and Dr. Gajanan Ingla sir from Devi Vishwavidyalaya University. For this, I would like to request Mr. Saurabh D. Jain sir to please welcome Dr. Love Kumar Soni sir. Next, I would like to request Ms. Antim Prajapati ma'am to please welcome Dr. Gajanan Ingla sir. Ladies and gentlemen, it's my privilege to introduce a truly remarkable individual, Miss Anusha Ji Agarwal. An accomplished professional, a visionary, entrepreneur, and a dedicated leader in every sense of word. Ms. Agarwal is a gold medalist in the management from NMIMS, Mumbai, and holds a master's degree from the prestigious National University of Singapore. Her academic excellence are a testament for the commitment to excellence and her drive to make a meaningful impact. Inspired by a deep passion for sustainability and social responsibility, Ms. Agarwal founded Anya, an international e-commerce brand that is more than just a business. Anna serves a powerful platform for empowering women and promoting sustainable entrepreneurship. Her commitment to ethical business practices was recently recognized with the ET Leadership Award in the lifestyle category, an honor that underscores her dedication for creating a passive impact through her work. As it is often said, success is not measured by position one holds, but by impact one makes. And Ms. Agarwal exemplifies it beautifully. Through Anya, she has shown that business can be a force for good and that meaningful success lie in empowering others and nurturing a planet. As Ms. Agrawal also brings a wealth of corporate experience, having worked as a research analyst at Citibank corporate office in Mumbai. Currently, she represents the Agrawal Group in overseeing management efforts in CDGR, where her vision and expertise are driving the institution towards new heights, creating opportunities for growth, innovation, and learning. Beyond her professional accomplishments, Ms. Agrawal is a person of diverse interest: fitness, travel, calligraphy, and signature analysis, to name a few. She embodies a commitment to continue growth both personally and professionally, inspiring around her. Anusha ma'am, क्या तारीफ करूं आपकी? बस फराज की शायरी नजर करना चाहूंगी। सुना है बोले तो फूल झड़ते हैं, ये बात तो चलो बात करते हैं। सुना है आईना तमसार जबा करती है, जो सादा दिल है उसे बन सवर के देखते हैं। Please join me in welcoming Miss Anusha Agrawal ma'am to address the gathering as she shares his inspirational journey and vision with us.
Thank you for the kind welcome. Honorable Principal Sir, Honorable Chief Guest, esteemed principals from various colleges, Subhash Sir, faculty members, and all dear students. I'm very excited to see the response for this national symposium, and I wish all of you the very best. We're very happy to have so many online registrations as well as offline registrations, and we're going to keep doing such good things. Like Sir said, AI is shaping all industries, and really excited to see what all of you have to bring to the table. I'm sure everyone has, the entire team has worked upon the symposium, the national symposium that we're conducting, and we'll keep doing such work, and all the best to everyone, all the students here, and everyone present here. Thank you so much.
Thank you so much, ma'am. Next, amongst us, we have the king of Chameli Devi Group of Professional Studies, Dr. Subhash Dhande sir. He's a person with a joy nature. He's very simple, always smiling, getting and giving always a positivity. With these words, I would like to invite sir for his words of wisdom.
Honorable dignitaries on the dais and off the dais. Basically, I am a person of commerce and management, so I am not very much aware about the different fields of pharmacy. But as Anjali ma'am has already introduced me, so simply I would like to extend best wishes to all the participants who are here to listen and present their views on this most important and burning topic of the current scenario. I think artificial intelligence is highly affecting every walk of life. Not only, as Arun sir already has mentioned, that not only it is the matter of engineering or computer science, but I think artificial intelligence is working and it is helpful in every walk of life. So I think the scholars and I can say the most experts in this field of artificial intelligence and pharmacy are here. So again, I extend best wishes to all of you. Thank you.
Thank you so much, sir. Now, it is a utmost honor to introduce a chief guest, a visionary in the field of pharmaceutical sciences and a dedicated educator whose contributions have shaped the future of pharmacy education in India, Dr. Dipendra Singh Ji. Dr. Dipendra Singh Ji serves at the University Institute of Pharmacy at Pandit Ravi Shankar Shukla University, Raipur, one of the oldest and largest universities in Chhattisgarh. He is also a nominated member of the Pharmacy Council of India, PCI, and currently chairs the Education Regulation Committee of PCI, where he plays a pivotal role in the shaping the future of pharmacy education across India. With over 20 years of teaching and research experience, Dr. Singh's presence areas of expertise include advanced bioactive delivery systems for wound management, protein and peptide delivery, tissue culture techniques, and innovative plant-based delivery systems. He has published over 150 research papers in leading national and international journals, assessing an H index of 34, I-10 index of 119, and more than 7,716 citations. Additionally, Dr. Singh has 2 Indian and 2 international patents, underscoring his commitment to innovation. In recognition to his research excellence, Dr. Singh has been honored with several prestigious awards, including Department of Health Research ICMR, Young Indian Biomedical Scientist Award, the UGC Raman International Award, and the UGC Research Award. In 2021 and 2022, he was ranked among the top 2 scientists worldwide in pharmacy and pharmacology by Stanford University, a remarkable achievement that speaks to his global impact. Dr. Singh is also the recipient of Young Scientist Award from the state of Chhattisgarh and has served as a state elevator and mentor for the National Children's Science Congress. He is a life member and vice president of esteemed professional bodies including the Indian Pharmaceutical Association, IPA, of Pharmacy Teachers of India, APTI, and the Indian Society of Pharmacognosy, ISP. His journey of knowledge has taken him around the world for scientific collaborations, including with prestigious institutions such as the University of Mississippi, USA, Deakin University, Australia, AIMST University, Malaysia, and University Sultan, Dublin, Malaysia. सर के लिए कुछ लाइंस बोलना चाहूंगी। सर, इन लाइंस के साथ आपको बुलाना चाहूंगी। सुनकर कर दे अनसुना, सुनकर कर दे अनसुना, ऐसी इनकी आवाज नहीं। मिलकर भूल जाए कोई, ऐसे इनके अल्फाज नहीं। किसी मंजिल में, किसी महफिल में छुप जाए, ऐसे इनके अंदाज नहीं। सूरज से दमकते हैं ये, किसी परिचय के मोहताज नहीं। With these lines, I would like to invite Sir on dais for his words of wisdom.
Somebody will recites about your achievement. I was also thinking, okay, this is about me. Thank you for quoting achievements, though I always say I consider myself as a learner, and still I am learning. How she is explaining me, so I am learning. Okay, fine. A very warm good morning to all of you. Dignitaries on the dais, my teacher and principal of this institute, Professor Arun Gupta. Executive member, representative of management, Mrs. Anusha Agarwal ji, Professor Subhash, and really it is a pleasure for me to be in this campus. Friend, I was talking to Arun sir, and he was sharing some facts about the institution. So I said, yes sir, before coming to this place, I have read a lot about your institute. I don't know how many of you have seen the today's newspaper, but today's newspaper is carrying one news that the chairman of this institute is only philanthropist in the list of Haruni, which has been always internationally it is known for having that list says about the people who are donating or who are contributing to the society, to their state, to their city, about their country. And just I was reading his statement that he is working for his city, society and the country. And just I was amazed to see the contribution what he has already made. So just I went through all the list, and it was given that from 11th and now this year also he is the only person who is in the list. So I think so you all are this is a matter of pride also, and you people are lucky that you are in such institute where the guardian is like that. और घर के बड़े और गार्जियन अगर आपके पास ऐसे हों तो मुझे लगता है आप किस्मत वाले लोग हैं. आप लोग को बहुत बहुत धन्यवाद कि आप इस इंस्टीट्यूट में हैं. People of the dais, lot of known faces, so many names. जैसे सर के यहाँ स्वागत में लोग भूल रहे थे, मैं नाम नहीं लूँगा क्योंकि मैं भूल जाऊँगा किसी का नाम तो परेशानी होगी. But all the known faces to whom I know, because this is always coming back home to me. I was sharing with Miss Anusha that I tried very hard to stay at Indore. I am sharing with you all. Very hard I tried with so many companies to stay at Indore because I was loving Indore so much. और मैं बोल रहा हूँ बहुत सालों तक तो मुझे अपना शहर इतने अच्छे से नहीं पता था जितना इंदौर अच्छे से पता था. But destiny is always there, and मुझे कहीं और जाना लिखा था और बार बार ऐसे आना लिखा था, तो मुझे यहाँ आना बहुत पसंद है. और जब indeed it was a very busy, I was very busy because right now we are working on the new syllabus and continuously we are having meetings, and because in the coming session we have to come with the new syllabus. So it was busy, but thanks to Dr. Gupta and Dr. Jain who are here, and they are continuously following me, and they were not requesting me, indeed they were giving order, Aana hai. So I said fine, and apart from Gupta sir, he is my teacher and I had learned my ABCD of pharmacy from him, and since so long we are connected. When he said Dipendra Aana, I said so finally I'll come. But again he was saying कि मैं अंदर से सोच रहा था तुम आओगे कि नहीं आओगे, but I said I'll come. So it is always a pleasure to be in such place where you are feeling that you are very happy, and it is always a pleasure for me to interact with this student and budding pharmacist, because friend, this is the time we are not. Right now, if you see, when I was studying, when Gupta sir was there was the issue of recognition. We all were fighting for our existence. We were presenting ourselves that we are a very important part of the healthcare system and we are the pharmacists. But if you see the current scenario, specifically after the COVID, everybody knows who is pharmacist. We have contributed a lot. We have done a lot in the society. We've gone to the society. COVID, when people were with doctors and nurses were busy in the hospital, we were the people, the pharmacists or the pharmacists who were available for all the public. और मुझे नहीं लगता किसी भी pharmacist ने कई सैकड़ों लोगों की counseling की होगी. So that was the time, and the same thing was also recognized by the government also. So this is the time when we are not fighting for the existence. Now you are fighting for the respect and recognition. So friends, first thing which I want to share with all the students, if you want to have respect, then respect cannot be demanded, it can only be commanded. And that command can only be through your knowledge. So first thing which I am requesting to all of you, that what the present course, syllabus and practicals you are having in your institute, do it very well. Know your subject. Last in the evening I was discussing with few of the colleagues, and everybody was criticizing about the temperament of the student, that they are not ready to learn. They are not बिकॉज मैं एक बहुत अच्छी बात शेयर कर रहा हूँ कि प्रैक्टिकल में जब भी वाइवा होता है, हम फार्मेसी पढ़ रहे हैं सर, वाइवा लेते थे तो जो आखिरी का बच्चा आता था, 40वां बच्चा, 40 का बैच था, तो सर के क्वेश्चन खत्म हो जाते थे क्योंकि पहले 40 वो पूरे आंसर उनको बता चुके होते थे, सर ये क्वेश्चन पूछ रहा है, उसका आंसर ये। तो कम से कम आपको अगर सर ने एक बच्चे से 5 क्वेश्चन पूछा तो 100-200 क्वेश्चन के आंसर सबको पता होते थे पूरे एंड तक। लेकिन इसी टेंडेंसी के बारे में अभी बात हो रही थी कि आप आज अपना वाइवा लीजिए, 5 क्वेश्चन से स्टार्ट कीजिए, वो 5 क्वेश्चन का आंसर आखिरी तक आपको नहीं मिलेगा। So that is the difference of the attitude on. So what I want to request you all, that go through your syllabus, do it very ethically, go through your syllabus. What the knowledge you are getting from your teachers, from the classes, from the practicals, get it. Because if you want to be a competent person or professional, definitely the knowledge is only support. And that is the reason that you will be respected. We are saying that we are equivalent, on every platform people will share with you that if you go to the European countries or so-called developed countries, then the pharmacist is treated equivalent to the doctor. Why he is treated equivalent to the doctor? And why we want to be equivalent to the doctor? Because they are having their knowledge. With knowledge they challenge the doctor. If we are the expert of the medicine, and if you are prescribing something which is not in line with the professional ethics or according to their activities or the doses, then he can give suggestion. There is not an issue of conflict. There is issue because we all, if you see the doctors and pharmacists, we both are working for the patients. For their well-being, if you are having your knowledge which can contribute to the doctor's knowledge, then it is that is a synergistic. So that is the requirement. Why we are continuously emphasizing on that, you should be very good in your subject and knowledge. Until you not have a knowledge, बहुत सारे लोग यहाँ बैठे हैं, मैं और भी बहुत सारे लोग हैं. I belong from the family of doctors, so you can understand what is my position. So initially he used to call me compounder. My brother, he was doctor, so I said it is not compounder, it is pharmacist. So that is, but again, if you are taking your subjects, your things very seriously, then you achieve a position. And now he respectfully, everywhere he mentions he is my brother, he is pharmacist. So that is the issue. What I am saying, what I want to communicate to you, that knowledge is the only support. And I am coming to this topic also. And if you will see the present scenario, the knowledge or information is not an issue. Because when we were going through the research or studies, if you are having any question from your mentor or guide, then you have to go to the libraries, go through the journals, go through the books, call your friend, and if you are capable, go to the cyber cafes and search about your topic and fetch some information, compile it. So it take that long time was involved in getting any information and proper knowledge about that topic. But right now, if you see, on a click you will get the information very accurate in what language you want to learn. Few months back we were talking about that AI will come. ChatGPT is something which is going to give the revolution to every area and every field. And now the chat, कितने लोग use कर रहे हैं ChatGPT? Almost teacher लोग हाथ नहीं उठा रहे, सबसे ज़्यादा वही use कर रहे हैं. So this is the point. अभी कुछ हम थोड़े समय पहले बात कर रहे थे कि ये आने वाला है और ये सबके हाथ में. And आपको पता है कि हम what we can do with the ChatGPT or what we can do with the AI. And friends, AI is not very new for the pharmacy. I don't know you know about that or not. But from 70s we are using AI in the pharmacy. The extent was not like that. But since if you see the research profile or profiling, the multinational companies were using the AI for so many purposes. But how it is made common, it was not like that. But who will be impacted first? हमेशा जो क्राइटेरिया है किसी चीज को फर्स्ट रखने का, either you are very big or you are very important. So if you see our field, अभी दो ही फील्ड की बात होती है. अभी हम बात कर रहे थे either it is pharma industry or IT industry. So you can understand what is the impact of AI will be on our profession. So it is changing. It is very fastly changing if you see it, and accordingly you have to also change with that. But here I am not discussing about because everybody has told what AI can do. But friends, there is issue with the using of that technology. What I, on the every platform, I am urging upon all of you that don't be slave of your technology. Be the master of the technology. Use that technology as a weapon. Don't be slave. If I'm not wrong, this is the time if I separate you from your phone, you start behaving very differently. This is a scientific study that in every 30 minutes or less than that, you know that if SMS or WhatsApp will come, there will be a beep or there will be a indication, जो भी आपने ringtone लगाया हुआ ringtone आएगा. But maybe it is not coming, but you will open your phone and check. Either there is a message, you know that there is no message, but still you will check it. So how we are addicted to that, how you are dominated by the technology. This is the issue. If you see your time, why we are lagging, what is the difference between our time and your time? There we were only having friends, playgrounds, teachers, library. Now you are having only phone. You don't need anything. If you are having phone, you can spend hours with your phone. And it is very helpful. अच्छा खाना खाना है, phone. अच्छा पहनना है, phone. Even अच्छी लड़की चाहिए शादी करने के लिए, phone. You will get your partner. You are having so many apps, so you go on it and you will find it. So how it is involved in your life. आपको बाकी सब चीज की जरूरत खत्म हो गई. This is the issue of what I wish to discuss with you. That if you are using the technology, use it very judiciously. Be the master of the technology. Continuously I am saying this word because it is very critical. At the same time, your teacher is using that AI and your student is also using that AI. Then how to be used? I was discussing with one of the very senior professor that if such thing, because we were discussing on the human and machine interface, and he was saying if brain is storing that information, then definitely if information is stored, then it can be copied. And people are working on it, the messages or the information what we are having, we will decode and we will copy it. So I said fine, because you have seen so many. पता नहीं आप लोगों ने film देखते ही नहीं. I am very fond of seeing the sci-fi movies. So there was a film called Chameli, and that the whole concept was that human brain can be copied into the robot. So I was just discussing the same thing. If in certain time, if we'll copy our brain or your robots will be like human, then what we will do? So बहुत अच्छा सा आंसर दिया कि what the weird differences we are having from the machine and human, that consciousness, the learning capacity. आप अपने experiences को उस ऐप या उस मशीन से उस दिन तक शेयर कर सकते हो जिस दिन तक का वो एक्सपीरियंस था, पर ह्यूमंस के साथ में हर दिन नया एक्सपीरियंस होता है, हर दिन नया रिएक्ट करने का तरीका होता है, उनके पास नहीं होता. जो आप उनको सिखाया उन्हें आखिरी, वो वहां तक सीख कर आए. तो दिस इज द डिफरेंस. सो दैट्स व्हाई आई एम सेइंग दैट यूज द टेक्नोलॉजी वेयर यू वांट टू यूज इट. Not you are supposed to be dominated by your technology and you are behaving like a slave that without that technology I will not do anything. And this is the condition I am telling you. It is not with you all, it is with me also. That I know something is not very important, but again I am busy with my work. So keep, this is one thing which I was willing to share with you. We are working on the new, and one more thing, very important, that when we were discussing about the for the first time after the COVID, we were called from the council to represent pharma profession by the even normally they never called pharmacists for such discussions, but at the same time at that time doctors, nurses and pharmacists were called for the discussion, and the issue was how the pharmacists can reduce the load of doctors while they are practicing in the hospital. So first time we were asked how we can help them. So there were so many issues we narrated that what we can do. And friends, I am telling you, after that representation, the government of India has decided that every hospital will have a clinical pharmacist. That is the area. So that is the importance, that जो ये बात है कि you are very important. हमारे अंदर आत्म गौरव का सबसे भाव होना चाहिए. हम बहुत इंपॉर्टेंट हैं और हमारे बिना दुनिया नहीं चलेगी. और मैं जो नॉलेज से कनेक्ट कर रहा था, वाई वी आर नॉट वेरी सीरियस अबाउट नॉलेज, बिकॉज वी नो दैट कि क्या हमसे क्या फर्क पड़ता है. नो, फर्क पड़ता है. आप हमेशा आपका डॉक्टर क्यों अपने नॉलेज से कॉम्प्रोमाइज नहीं करता है? जो डॉक्टर पढ़ता है वो कॉम्प्रोमाइज क्यों नहीं करता है? क्योंकि उसको पता है कि अगर वो गलती करेगा तो एक जान जाएगी. उतने इंपॉर्टेंट आप भी हो, लेकिन आप सोचते हो कि मुझसे क्या फर्क पड़ता है. So here it is required that be very important. आपको अपना आत्मगौरव का भाव होना चाहिए. आप एक बहुत इंपॉर्टेंट कंपोनेंट हैं इस पूरी सृष्टि में, और आपके जो एक्ट हैं वो सबको इम्पैक्ट करते हैं. तो आपके एक्ट बहुत अच्छे होने चाहिए, ये आपको रियलाइज होना चाहिए. There are a lot of things. I think so. The program is scheduled so many things, and being a teacher, I can talk to you for hours. So there are very few important things that we should know. If you see, जब सर बोल रहे थे कि मैं उनका टीचर हूँ, उनको देखना अच्छा लगता है, तो मैं आपके साथ एक बहुत अच्छी बात शेयर करता हूँ. सिर्फ दो ही लोग हारना पसंद करते हैं, एक आपके टीचर और एक आपके माँ बाप. अगर आप कहीं उनसे जीत रहे हैं तो दो लोग ही मुस्कुराते हुए आपको मिलेंगे. बाकी दोस्त हैं तो आपने 3 इडियट्स का तो पढ़ा ही होगा. तो सर थैंक यू. हम लोग बहुत लकी थे, एंड आई एम टेलिंग यू व्हाई आई एम टेलिंग यू कि यू आर एट द बेस्ट प्लेस, बिकॉज ऑलवेज वी आर इन सर्च ऑफ समथिंग बेस्ट, एंड यू most of the time you give or you spend it is for the searching ki what best I have to get. But no, what the best you are having, it is here. The best time, the best teacher, the best institution, the best friends and the best community, best country. कुछ खोजने की जरूरत नहीं, जो है यहाँ है. मैं बार बार एक स्टोरी सुनाता हूँ आपको, और मैं बहुत सारे लोग इससे कन्विंस हूँ, मुझे नहीं मालूम. मध्य प्रदेश में एक युगबोध प्रकाशन की बुक चलती थी, पता नहीं सबको याद है, सबको ध्यान दो. मैंने पीएमटी दिया था, मेरा सिलेक्शन नहीं हुआ था. तो मुझे बहुत क्यूरियोसिटी थी कि मतलब पीएमटी में जिनका सिलेक्शन हुआ बात करना हमेशा अच्छा लगता है. तो मैं बहुत दूर से ट्रैवल करता था पढ़ने के लिए. मैं बता रहा हूँ, मुझे 1 दिन लगता था आने के लिए फार्मेसी करने के लिए. उसमें सिर्फ 4 कॉलेज थे अपने स्टेट में. तो मेरे बगल में एक बच्चा बैठा था और मुझे बहुत फैमिलियर सा दिख रहा था. तो मैंने उससे पूछा कि तुम मुझे बहुत फैमिलियर से दिख रहा हो, मुझे देखा देखा सा लगता है. बोला हाँ आपने मेरे को देखा होगा. बोला कैसे? बोला अभी कुछ दिन पहले मेरा पेपर में, पूरे न्यूज़पेपर में फोटो छपेगा. तो मैंने क्यों? बोले मैंने पीएमटी में टॉप किया. सो आई वॉज वेरी मच क्यूरियस कि उसने टॉप किया, तो उससे बात करूँ कि आखिर उसने क्या किया. तो मैंने उससे पूछा कि अच्छा तुमने तैयारी कैसी की थी, कैसे पढ़ाई करा. तो उसने मुझे बड़ी अच्छी बात बोली कि सर मेरे पास 3 बुक है, फिजिक्स, केमिस्ट्री और बायोलॉजी, युगबोध प्रकाशन की. बोला और कुछ नहीं है मेरे पास, लेकिन मेरे को मेरी तीनों किताब बहुत अच्छे से आती है. तो उस समय सोच रहा था कि जब मैं तैयारी कर रहा था तो मुझे फिजिक्स के 3 किताब थे, केमिस्ट्री इससे पढ़ लो, उससे पढ़ लो, उससे पढ़ लो, बायोलॉजी इससे पढ़ लो, उससे पढ़ लो, उससे पढ़ लो, ये वहाँ के नोट्स हैं, ये उस कोचिंग के नोट्स हैं, ये इस कोचिंग के नोट्स हैं. सो वी वर इन द सर्च ऑफ समथिंग बेस्ट, फ्रॉम दैट आई गेट समथिंग, बट व्हाट इट वाज देयर आई वाज नॉट गोइंग फॉर. आप अपने मैक्सिमम समय को यूटिलाइज नहीं किया प्रॉपर, जो आपके पास था, जो था उसी से पढ़ लेते आप. सो दैट्स व्हाई आई एम शेयरिंग विद यू कि हम कई बार बहुत अच्छे की खोज में जो आपके पास है वो आप सब उसको छोड़ देते हैं, और वो आप लूज कर जाते हैं, आप वो टाइम, वो समय, और वो हम कर नहीं पाते. इसीलिए मैं बोल रहा हूँ कि दुनिया में सबसे अच्छा इंस्टीट्यूट वही इंस्टीट्यूट जहां आप पढ़ रहे हो, सबसे अच्छे टीचर वही है जो आपको पढ़ा रहे हैं, सबसे अच्छे दोस्त वही है जो आपके पास अवेलेबल है. बहुत सारे लोग पीछे हंस रहे हैं क्या? सही में अच्छे दोस्त हैं, और रियलाइज आपको तब होगा कि जब आप 4 साल बाद उनसे अलग हो. सो दैट इज द रीजन व्हाई आई एम शेयरिंग विथ यू दैट यू पीपल आर वेरी इंपॉर्टेंट. आपको अपना सब्जेक्ट, अपना नॉलेज बहुत ध्यान से पढ़ना है, फार्मेसी को बहुत अच्छे से करना है, क्योंकि जितने कॉम्पिटेंट फार्मासिस्ट आप रहेंगे उतना ही प्रोफेशन हमारा ग्रो करेगा और हमारा अच्छा नाम होगा. और हम इस पूरे सोसाइटी में देखिए, देयर आर फ्यू बिजनेसेस वेयर यू आर अर्निंग योर लाइफ एंड यू आर ऑल्सो सर्विंग द सोसाइटी. आप ह्यूमैनिटी को सर्व करते हैं. सो यू आर इन सच प्रोफेशन बाय विच यू आर अर्निंग योर लाइफ एंड एट द सेम टाइम यू आर सर्विंग टू द सोसाइटी ऑल्सो. आप कितने अच्छे प्रोफेशन में. तो हमको हमेशा इस बात का गौरव होना चाहिए कि आप काम करते करते किसी की सेवा कर सक रहे हैं या कोई कंट्रीब्यूट कर रहे हैं सोसाइटी में. इट इज द बेस्ट थिंग व्हाट यू कैन हैव इन योर लाइफ. So we are in such profession. So always have a pride that we are pharmacists. At the last, I always urge to the student. मेरे कुछ बातें हैं जो 4-5 मैं चाहूँगा कि उसमें से आप कुछ भी बात माने, तो शायद हम सबका बहुत भला होगा. First, say no to any type of addiction. It can be your phone. बाकी चीज पे मैं नहीं जा रहा हूँ, मैं सबसे पहले यहीं पे आ रहा हूँ. पर किसी भी तरह के एडिक्शन को नो बोलना, पहला. दूसरा, एटलीस्ट इनकलकेट द हैबिट ऑफ रीडिंग. अभी हमारा टाइम क्या है, मैं रीड करने के लिए बोलूंगा तो आप अपना फोन खोलो. फोन नहीं, फोन के अलावा आप सोने के पहले अपना फोन थोड़ा अलग रख दो और आप पढ़ो. वो जो अच्छा लगता है पढ़ो, कहानी की किताब पढ़ो, न्यूज़पेपर पढ़ो, जो पढ़ना है पढ़ो, पर हार्ड कॉपी से पढ़ो. और आप 1 महीना करके देखो, यू विल फाइंड चेंज इन योर पर्सनैलिटी. आप इसको एक्सपेरिमेंट के तौर पे आप 15 दिन कर लो, 1 महीने कर लो. सोने के पहले 2 घंटे पहले, 1 घंटे पहले अपना फोन दूर रख दो. आप कुछ पढ़ो और पढ़ के सो, ठीक है, ताकि सुबह बढ़ के उठो. थर्ड, डू एक्सरसाइज, योगा. व्हाई आई एम सेइंग, बिकॉज you are in such profession that you are dealing with the ill people, suffering people. वहां पे आपका स्वस्थ होना और मेंटली और फिजिकली दोनों बहुत इंपॉर्टेंट है. तो एटलीस्ट गिव 45 मिनट्स टाइम फ्रॉम योर लाइफ टू योर एक्सरसाइज. कम से कम 45 मिनट सबको ही अपने हेल्थ के ऊपर लगाएं. 45 मिनट बहुत कम समय बोल रहा हूँ मैं, मिनिमम बोल रहा हूँ, इससे ज़्यादा आप लगा सकते हैं, पर कम से कम 45 मिनट्स अपने ऊपर लगाएं और अपने को फिजिकली और मेंटली फिट रखें. फोर्थ, very important, always respect your teachers and your mother and father, your parents. हमको हमेशा उनका गौरव होना चाहिए, हमको हमेशा उनका प्राइड होना चाहिए और उनकी हमेशा रेस्पेक्ट करनी चाहिए. हो सकता है कि आप अपने माँ बाप से ज़्यादा क्वालिफाइड हो जाएं, पर कभी भी जीवन में उनको डिसरेस्पेक्ट नहीं करना, हमेशा उनका रेस्पेक्ट करना. और जब आप ये करते हैं तो आप देखिएगा कि आपके ऊपर हमेशा आशीर्वाद रहता है लोगों को. आप कई बार आपको ऐसी चीजें अचीव होती जिसके बारे में आप सोचते नहीं हैं. और मैं एक एग्जांपल, ठीक है. एंड लास्ट, दैट एटलीस्ट प्लांट अ ट्री इन अ ईयर ऑन एनी ऑफ योर बेस्ट डे. एक बार मैं बोल रहा हूं, सिर्फ साल में एक बार एक पेड़. अब इसमें से कितनी बात लोग मानने वाले ये बता दो. हाथ उठा लो, कोई एक बात मानने वाले. चलो, थैंक यू सो मच फॉर अंडरस्टैंडिंग एंड गेटिंग दिस. So thank you Arun sir and the management of CDGI for inviting me in this symposium. I am very much delighted and indebted by this invitation. Thank you so much. Jai Hind, Jai Bharat.
थैंक यू सर. डेफिनेटली आपने इतनी सारी बातें करी, इतना अच्छा माहौल क्रिएट हुआ. स्टूडेंट्स, स्पेशली माय फाइनल ईयर स्टूडेंट्स, इतने ध्यान से उन्होंने आपको सुना. आई होप ये बात उनको जरूर याद रहेगी. आई कैन सी देयर फेसेस. Thank you so much sir for inspiring words and for sharing your vision for the future of pharmacy and healthcare. Your dedication and contribution truly resonate with the theme of our conference, leaving us all with a renewed sense of purpose and insights. Now, we come to a special moment in our symposium, the Grand Souvenir Release. This souvenir is not just a collection of memories, but a testament to the hard work, dedication, and collaborative spirit that has brought this event to life. It captures the essence of a symposium theme, AI, RadPharma, the future of medicine through artificial intelligence in Radiopharmaceuticals, and is a field with insights, achievements, and visions for the future of healthcare and pharmacy. हर पन्ना इस यात्रा की कहानी कहता है, विज्ञान के नए आयामों की झलक दिखलाता है. This souvenir symbolizes a commitment to knowledge, innovation, and transformative power of collaboration. It will serve as a keepsake for all those who have contributed to and participated in this event, reminding us of the purpose and passion driving the future of pharmaceutical science. We are honored to invite our dignitaries in the dais to proceed with the souvenir release ceremony. May this movement be a lasting twinkle or contribute to the vision and efforts that have made this symposium possible. Please join me in celebrating this grand release with a round of applause, making yet another milestone in a journey towards excellence and progress in the field of healthcare. Thank you. To honor our esteemed guest with a token of bouquet, now may I kindly request Ms. Anusha Ji Agrawal ma'am to present a memento to our chief guest Dr. Diploma Singh Ji as an appreciation for his invaluable presence and contribution today. Thank you to all our esteemed dignitaries for joining us on this dais and for your contribution to this memorable inauguration ceremony. We are truly grateful for your inspiring words and presence. As we now move forward with the next segment of our program, may I kindly request all the dignitaries on the dais to please take the seats in the auditorium. Inspiring words, it's time to enlighten the mood with a touch of entertainment. Celebrating the journey and spirit of Chameli Devi Institute of Pharmacy and the cultural diversity of India. Over the years, CDIP has evolved into a beacon of knowledge and innovation, nurturing young minds and advancing healthcare education with a relevance commitment of excellence. Yesterday was a dream, tomorrow is a vision, but today, well lived makes a vision, and every yesterday, tomorrow, a dream of hope. Getting the same vision with the CDIP is playing a significant role in the CDIP, playing in the holistic development of young professionals in addition to bridging the gap between all levels of quality education. On 19 June 2018, the foundation stone of CDIP was established with a vision to provide quality pharmaceutical education and create pharmacists who care for human health. This short video will take you through the remarkable milestones, achievements and aspirants of CDIP, showcasing the dedication and growth that have shaped us in the institute we are today. Let us take a moment to celebrate this journey of progress, innovation and commitment to a brighter future in pharmaceutical science.
Sector, Chameli Devi Institute of Pharmacy, Indore is one of the most preferred destinations for pharmacy students in this region. Chameli Devi Institute of Pharmacy offers undergraduate, postgraduate and diploma program. The institute is affiliated with RGPV University Bhopal and approved by PCR and AICTE. This institute, with a built-up campus area, started with the best infrastructure facilities comprising modern audio-video classrooms and fully equipped laboratories. Technologically advanced computer center and knowledge-rich library for the benefits of students and faculty members. Laboratories for UG and PG courses are provided as the norms for regular practicals as well as research activities of the institute. The CDIP laboratories provide the knowledge about the manufacturing of the pharmaceutical preparations and help in training the students in drug formulations like tablets, capsules, parenterals, ointments, creams, eye drops, syrups, drug interaction, stability, etc. The institute has more than 7,000 books and e-journals, e-books, periodicals, etc. Institute works for students to promote leadership, human relations, extracurricular, co-curricular, sports and cultural activities, along with the celebration of national festivals and spectrum of events, community service activities, social activities for free childhood checkup camp, and other channels. Institute conducts national or international conferences to promote students and socialize them.
Hope you all enjoyed the CDIP journey. Now it's time to infuse this stage with the vibrant colors and energy of India's rich cultural heritage. We are thrilled to present a mesmerizing dance performance by traditional and the talented B-Farm students who will be performing a unique combination of Bihu, Dhunuchi and Rajasthani folk dance. Each style celebrates the diversity, joy and spirit of India. From the high energy beats of Bihu from Assam symbolizing the vigor of life, Dhunuchi dance of Bengal where the rhythm and devotion combines with swelling incense filling the air with divine energy, and finally the majestic and vibrant Rajasthani folk dance bringing the elegance and endure of Rajasthan's cultural legacy of life. Now all of you, please put your round of applause For this mesmerizing dance performance, I request the performers to please come on the stage. B.Pharm second year students. such a wonderful dance performance. Now, as we come to the conclusion of this memorable inauguration ceremony, we would like to take a moment to express heartfelt gratitude to everyone who made this event possible. To formally convey our thanks, I now invite convener of the conference to deliver the vote of thanks. Please join me in welcoming Mr. Saurabh D. Jain sir on stage.
A very good afternoon to one and all present over here. As the convener of this symposium, I feel honored and privileged to get the opportunity to propose vote of thanks on this special event. I extend my heartfelt gratitude to Board of Research in Nuclear Sciences, Mumbai, for invaluable support and sponsorship which made this event possible. Sponsorship has not only provided necessary resources to organize this kind of event, but also provide a platform for knowledge sharing, collaboration and professional development. A special thanks to our esteemed chief guest, Dr. Dipendra Singh sir, for sharing their valuable insights and knowledge. My gratitude to our principals and professors representing various institutions who have graced this symposium with their presence and support. I would like to express my sincere thanks to Patron, Chief Patron and all the principals of CDGI Group for your guidance and unwavering support. Last but not the least, I would like to thank to staff members of CDIP, my dear students and volunteers for their hard work behind the scene. Thank you so much. Thank you.
Now we conclude this inauguration ceremony. Let us raise and join together for the national anthem, paying tribute to a nation and celebrating the unity and pride that binds us all.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल गंगा विंध्य हिमाचल यमुना गंगा उज्जल जलधि तरंगा तब शुभ नामे जागे तब शुभ आशीष मांगे गाए तब जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे भारत माता की
Thank you everyone.